All right, it looks like it's a little bit after 12. Why don't we get started? My name is Scott. I'm the marketing manager for the exam prep products at Springer Publishing. And as part of our NP Week celebration this week, we are presenting a session today on preparing for the NCC C-EFM exam with Dr. Antay Waters. Dr. Waters is a board-certified women's health nurse practitioner, a certified nurse midwife, and a certified registered nurse. She's also the author of many of our Springer exam prep products on the C-EFM exam. So she is all over the C-EFM products that we have. Before we begin, just a quick reminder, this webinar is going to be recorded and will be available on demand at springerpub.com/videos in about 5 to 7 days. If you have any questions, feel free to type them into the Q&A box or into the chat box. We'll bring them to Dr. Waters' attention, and then we can get an answer. So please remember that at the end of the presentation, there will be a brief survey. And if you didn't get your question answered today during the session, we can probably try to get back to you over email. So with that said, let's turn it over to Dr. Waters. Thank you so much.
Hi, everybody. I'm Antay Waters. Good morning from Texas. It is still morning here. So let's move into our content. So objectives for this webinar, we want to look at what the C-EFM exam is and its role in professional practice, look at the eligibility criteria, as well as determine a path for success to prepare for this exam. Kind of misconceptions about what this exam is. So keep in mind, it is not isolated to just interpreting strips. I have had colleagues who have gone into this test and thought, oh, I can read a strip, I'm going to pass this test, and that has not gone well. It's not a test of your clinical experience in labor and delivery. It's not an assessment of your ability to manage complicated deliveries or how to perform invasive procedures. It's not a comprehensive evaluation of all aspects of intrapartum nursing. It doesn't include medication administration, pain management, postpartum care. And it's not a replacement for the A1 intermediate or advanced fetal monitoring, but it is an excellent preparation tool. It's not a test where your clinical judgment or what you would do in your facility is the answer. We're looking at standardized, evidence-based interpretation and management, and this can really trip some people up. This is a true, if I worked in Utopia General. It's not a pass-fail assessment based on subjective interpretation. Again, objective criterion reference scoring with established cut scores. It's not focused on legal documentation or medical legal aspects of fetal monitoring. We know there's plenty of that out there. And it's not a test of advanced maternal fetal medicine or high-risk obstetric complications beyond their impact on fetal heart rate monitoring. So if that's what it's not, let's talk about what it is. The C-EFM exam is a specialty certification exam administered by the National Certification Corporation, or NCC, that validates competency in electronic fetal monitoring interpretation and management. It's an exam focused on three main domains: fetal heart rate, pattern interpretation and classification, uterine activity assessment, and the clinical management interventions based on those findings. It's a test on standardized nomenclature and the classification systems, particularly the three-tiered fetal heart rate classification system, as well as a systematic approach to strip interpretation, so that category 1, 2, 3 that we all know and love. It's an assessment that requires you to apply physiologic principles to understand the mechanisms behind what we're seeing on the strip. Are we seeing uteroplacental insufficiency? Are we seeing cord compression? Are we seeing a fetal response to contractions? And this is the area that probably requires the most study for people, because we really focus on those strips and we know what interventions go to what we see, but sometimes we don't really stop and think about what's the physiology, what's happening that's causing what we see. And this exam really hits on that hard. It's an exam where pattern recognition and systematic interpretation are essential skills. You've got to be able to identify your basic baseline, variability, accels, decels, and do so accurately. It is a professional credential that enhances your clinical competence, and credibility in providing safe intrapartum care. So let's talk about the role of certification in professional practice. It provides professional recognition and credibility. It demonstrates specialized expertise and advanced knowledge beyond basic licensure to your colleagues, to your employers, and to our patients. It validates our commitment to professional excellence and lifelong learning in our specialty area, and also distinguishes you as a clinical expert in electronic fetal monitoring among your peers. Next, it shows quality and safety. It provides an evidence-based framework for consistent, standardized interpretation of fetal monitoring strips, reduces practice variation by establishing a common language and classification system across providers. It enhances patient safety through validated competency in recognizing concerning patterns and implementing timely interventions. And it contributes to improved maternal and fetal outcomes through evidence-based clinical decision-making. Next, it may also have some opportunities for career advancement. It may open doors for leadership opportunities, specialized roles, and advancement within your organization. It may fulfill requirements for certain positions in labor delivery, high-risk units, or education roles. In one of my roles, it actually serves as my annual fetal monitoring requirement because I have to do CEs to maintain the certification. So they know that while I have the certification, I'm doing CEs to maintain it. I then don't have to do the online 3-hour training that our facility requires. So if you have the certification, you might talk to your facility about that. It strengthens your resume and professional portfolio for job applications and promotions. And it's increasingly preferred or sometimes required by magnet-designated hospitals and leading healthcare institutions. Next, it provides an opportunity for personal and professional growth. It increases your clinical confidence in interpreting complex fetal monitoring scenarios. It deepens your understanding of the physiological basis for the patterns that we see, as well as why we do the interventions that we do. It motivates structured learning and mastery of current evidence-based guidelines. You have to understand them to do well on this exam. And it provides a framework for mentoring and teaching less experienced colleagues. Next, it provides some legal and risk management. It demonstrates adherence to national standards of care and fetal monitoring. It provides documentation of a specialized competency in medical legal context and shows commitment to maintaining current knowledge in an area with significant liability concerns. It also supports the defensibility of clinical decisions based on nationally recognized standards. We all know that fetal monitoring strips are one of the most highly contested areas that often lead to lawsuits within the obstetrics field. Next, it provides organizational benefits. It contributes to your facility's reputation for nursing excellence and quality metrics. It supports magnet recognition criteria for specialty certification among nursing staff. And it may qualify for differential pay, bonuses, or other financial incentives offered by your employer. And finally, it enhances the unit level expertise and the consultative resources for complex cases for both yourself and your colleagues. And finally, it provides servant leadership and stewardship. It reflects faithful stewardship of your nursing talents or your medical talents and your calling to excellence in care. It positions you to serve as a resource and a mentor for colleagues seeking to grow professionally. And it demonstrates integrity and accountability in maintaining that specialized knowledge. So what's the eligibility criteria? The only eligibility criteria for the C-EFM exam is that you have a current, active, unencumbered license in the US or Canada as either a physician, a registered nurse, a nurse practitioner, a nurse midwife, physician assistant, or paramedic. That's it. Now, I would certainly not recommend someone without much experience to go take this exam, but the only actual requirement is that you have a current, active, unencumbered license. So you think you're ready to pursue certification, so now what? And this really can apply to not only the CEF exam, but really any certification exam. So really the first step is to look at your readiness. Maybe that looks like taking a practice test. Maybe that's talking to colleagues who have obtained the certification. How ready are you and what kind of preparation do you need? The second step is to develop a study plan. Just like you did in your undergraduate or graduate studies, we don't go into this blindly. We want to have a plan. There are lots of great opportunities to help you develop that. But certainly, one of the things that I recommend is schedule your exam and work backwards. One of the things that I see with students and colleagues is that if they say, okay, I'm going to wait to schedule until I know that I'm ready, then they just put it off and put it off and put it off. To whereas if you register and you schedule, you have a commitment to it, you're financially committed to it, and so you're more likely to follow through with that. Step 3, you want to gather high quality resources. Springer certainly has some high quality resources for you, and not only CEFM, but in other areas. Definitely find you some good resources. It can really impact your success on an exam. Step 4, you want to master the fundamentals. And so in this particular arena, we're talking about the physiologic basis. Again, we often think about this as, oh, can I interpret a strip? Well, while that's important, you have to understand the physiology behind it. And so that's why in this course, we devote a lot of time to the physiology behind fetal monitoring. And having a really strong basis will make that pattern recognition easier. The next step is to build your pattern recognition skills. Keeping in mind this is a time test, you have to be able to look at a strip interpret it and make a decision quickly, just as we do in clinical practice. We don't have 15, 20 minutes to really break down a strip. We have to be able to look at it, interpret it, and act on it quickly. And the next step, you want to make sure you have good test taking strategies. There is an art to taking a test, and just as we have done with all of our licensure exams, we want to make sure we have those test taking strategies down. And within this product, we have focused on some of those test taking strategies to really make sure that you're prepared in that area as well. The next step, make sure you're using practice questions effectively. Practice questions are great, but really just make sure you're not trying to memorize those. Really try to understand them. Read your rationales. Try to understand why each answer is wrong, as well as why the correct answer is correct. The next step, address your knowledge gaps. So now you've taken a practice test, you've gone through content, take another practice test, see what you're missing. Is it really focused in one particular area, or is it really generalized? And when you can figure out where your gaps are, you can really study your focusing so that you can be very effective with your time, because we all know that time is something that's so precious and we don't necessarily have a plethora of. The next step, make sure you manage your test anxiety and your self-care. People kind of underestimate this. I also teach in an undergraduate institution, and I talk a lot about test anxiety with students. And believe it or not, people who are really successful and have lots of certifications like myself, I have really bad test anxiety. And so it's something I really have to consciously manage. And so I would encourage you to figure out, what does that look like for you? And how can you manage that while providing some self-care so that you go into this exam not full of anxiety, but full of confidence. And finally, the last step is that final prep and that week leading up to your exam. I always encourage people, yes, do some reviewing, but when you get to the day before the exam, just set it aside. If you don't understand it or know it by an hour before your test, sitting in your car and trying to cram is not going to do anything but raise your anxiety. So really take those last couple of days and that week before your exam, review those knowledge gaps, but give yourself a day with no book to really manage that anxiety and do something for your own self-care. So let's talk for just a second about some test day success tips. Make sure you read each question completely and carefully before you look at your answer choices. One of the strategies that I have done ever since I was an undergraduate student myself, I will actually take and I will cover up the answer choices. I'll read the question. I will formulate an answer in my mind before I ever look at the answer choices, excuse me. Because if I can look at those answer choices and it matches what I've already formulated, I don't have the opportunity to talk myself out of the correct answer. So that's one strategy. There are many out there, but just make sure you understand what the question is asking and not let the answer choices distract you from the correct answer. Trust your preparation and your clinical knowledge. Your first instinct is usually correct. I tell people, don't change your answer unless you have accidentally clicked the wrong thing or you are completely sure that what you selected was incorrect. This gets people all the time. They change a correct answer and it's really difficult to watch. You can always mark difficult questions for review, but keep moving forward to manage your time effectively. Again, it is a timed exam. If you have something, don't spend too much time on it, flag it and go back to it. Stay focused on one question at a time. Don't let challenging items derail your confidence. Again, those difficult questions, if you're just not sure, if you're really kind of going back and forth about it, flag it, move on, answer some easier questions, build your confidence up, and go back to it before you submit your exam. And remember that the exam tests standardized evidence-based practice, not your personal facility protocols. This gets really hard for people who are out in clinical practice because we know what our hospital would do or what our facility would do, but we have to remember it's not about what our facility would do, it's what does the evidence say. After the exam, recognize you've invested in your professional growth regardless of the outcome. If you're successful, celebrate that achievement and plan for recertification in 3 years. But if you're unsuccessful, review your score report to identify areas to focus study and to reapply with renewed preparation. Can you give me my next few points, please? Use your knowledge to enhance your clinical practice and mentor your colleagues. Next, please. And finally, remember, success requires dedication, systematic preparation, and confidence in your ability because you've got this. All right, and I like little cartoons. And so this was one of my favorites. I get teased by people a lot because I have multiple certifications that I say, oh yes, I am fully certified. And just remember at the end of the day, you can do it. Your preparation will move you in the right direction, and just be confident. Even if it takes a second try, that's okay. All right, so we do have some time for Q&A. Let me get where I can see questions.
So while we're waiting for some questions to come in, and I'll remind anyone who's attending that you can answer, sorry, I can't talk. You can enter your questions into the Q&A box or the chat box, and I will bring them to Dr. Waters. But while we're waiting, so you had just mentioned dual certification, which is something that we've seen come up a little bit over the course of the MP Week sessions. What are can you go into that a little bit more? Maybe what are some certifications that you've noticed tend to go more along with C-EFM? I know that from the exam prep side, we have a lot of RN-COB. We see a lot of neonatal overlap. So I'm just curious what your thoughts are there.
Yeah, so for me, I'm a women's health nurse practitioner, and my certified nurse midwife. But as far as ancillary certifications, I recently took one of the brand new NCC exams, which is the COBE, so Certified in Obstetric Emergencies. I think that is a great complement to the EFM, because many of the things we see in EFM are obstetric emergencies. That test actually just launched in July. So we'll see how popular that one becomes. I thought it was a well-written exam. You'll see RNCOB. There's also a quality improvement certification exam by NCC. Those are probably the ones I see the most with the inpatient labor and delivery nurse practitioner who works on the inpatient side, midwives. Those are really the ones we kind of lean towards.
Yeah, that's very interesting. Thank you for explaining. We also, again, I think that there's a couple questions coming in. Another thing that we've seen a bunch this week, and I was wondering if you have some thoughts on, is the role of technology in the space. I think that nursing is obviously being transformed in so many ways by technology, and I'm curious how technology might be impacting the EFM, or kind of just more generally anything to do with maybe fetal nursing.
It's very interesting. I had this conversation with a colleague last week. Whether you realize it or not, we use AI in EFM. It's built into my facility uses centricity. It's actually built into centricity. If you ever see that it's trying to tell you, oh, this is a variable, this is a late, that's AI trying to read the strip. But at the end of the day, you have to rely on your judgment. And this conversation came up because I was looking at a strip with a nurse. She had let the automated system chart it as it was, and we had to talk about it. It's like, okay, but is that really what it is? I mean, it's trying to evaluate it, but we also know there's lots of nuances to fetal monitoring. And so I would just encourage people, yes, it's there, it's a great tool, but just make sure you're not over relying on it, and really using your own clinical judgment and what you know to be true in this space.
Yeah, that makes a lot of sense. I mean, it's almost like this idea of responsibly using it, because you can't get away from it, and you probably don't want to an extent. In the future, 5 years from now, it's probably going to be much sharper and better possibly than what we're seeing now. So that's interesting that you say that. I did get a question in the chat that is asking, what would you suggest is the best way to review, whether it's going over the review and the practice questions, or is there maybe a different way to prepare for studying for your exams that you might suggest, a certain order?
Yeah, so when I took this exam, there was not anything out there to prep with. So I'm grateful that I had the opportunity to put something out in this space. I am personally a fan of products like Springer has built, where there is content, there are review questions embedded within that content, and then you have the full-length practice test. I think that people underestimate those full-length practice tests, because those tests are built with the exam blueprint in mind. So they are built with questions that will mimic what your exam may look like. Because sometimes we get into those chapters and we're really focused on one content area, and we go, oh, these questions are really easy. But then when you jumble them all up, it's like, oh, okay, well, now I'm having to think about all these different things. And so I personally, when I'm prepping for anything, I try to do a practice test just to see where I am. I still review all of the content because I think that's valuable. but really focus on the areas where maybe I'm not as familiar with or that I need to really build my confidence in. And then take at least one more practice test and make sure that those areas where I wasn't as strong, that I pulled those up to a level where I'm confident that I'll be successful.
Yeah, that's great. That's so helpful. And a question kind of related to that, that again, I'm just thinking about questions that we see a lot. What happens if someone doesn't pass? I'm sure everybody wants to pass on the first try, and hopefully they do. But what would your advice be to somebody who maybe they need to reflect and try to take it again?
Yeah, so don't give up. Um, for sure, if you didn't use any sort of exam prep the first time, maybe really look at investing in something for exam prep. Um, you should get a score report that tells you what area you are not as strong in. Typically with NCC, their reports are going to say something like strong, weak, very weak within each area. Unfortunately, with this exam, there's only three big key areas, so it's not as useful. But even just thinking back to your exam, to your questions about which things tripped you up and which things were you not confident in, because we kind of know. We know what areas that we weren't ready in when we see the question. And spending some time in those questions, in that content, doing practice questions, really digging deep, whether it's with an exam prep. If I'm a book in my hands kind of person, I'm not great with the online products. So I know that for me, I like to watch the videos. I like a book in my hand that I can write in, that I can highlight, that's just how I learn. And so you should really evaluate, what did you do the first time that helped you, um, that maybe didn't help you as much as it could have, and how can you make changes? I believe with NCC, there's a 45-day waiting period to retest, but I would go ahead and encourage you to re-register, because if you don't, then you're just going to think, oh, I just can't do this, and you may not ever register again. You've already invested this much into it. Get re-registered. And really, if you have the opportunity, NCC very often does the Take Two promotion. I believe it actually may have just ended. Um, but if you're not signed up for NCC emails, sign up for those emails. When you see that Take Two come up, sign up for it, because that basically means that you can test. If for whatever reason you're not successful, you don't have to pay to test again. And so that's also a really great opportunity that NCC provides for us to help you be successful.
Yeah, what a great opportunity. I'm so glad that you mentioned that. And it is very fascinating what you mentioned about different learning styles, because that's something that at Springer we spend a lot of time thinking about the video products that you just worked on, or some people just love that textbook or physical flashcards, and then other people they want to study on their phone on the bus or during their lunch break. So there's so many different ways that people learn, and it's almost like no two students are exactly the same in that way. Um,
Absolutely.
no, sorry, go ahead.
No, absolutely.
But probably the last question maybe for us is just because you brought it up, what is that hard? I'm sure that this is probably the million-dollar question. When you're thinking about where students get tripped up the most, what is that very hard topic or series of topics? Do you have one that you've noticed it skews a little bit more towards people struggle on one specific thing?
Absolutely. Uterine placental physiology, fetal circulation. It's something that we learn in school, whether it's nursing school, NP school, CNM programs, medical school. We all learn about it. But it's often we just kind of tuck it to the back of our minds. But it features very, very heavily on this
Mm,
exam. Um, and it's very interesting, because again, I've had colleagues who have taken this exam and who really just thought, oh, I'm going to look at strips. I can pick out what a variable is. I can pick out what these things are. But then when they're presented with a clinical situation that gives you a clinical scenario and it says, what might this strip look like? You have to think backwards. And so you have to understand physiology in both directions. Not only here's a strip, what might be happening, but here's a scenario, what might this look like? And so if you don't have a really strong, deep understanding of it, that really trips people up.
wow. So for our students who are joining us, it sounds like physiology. If you don't already know it, that's where to spend maybe a little bit of time acquainting yourself with those topics. So
And we
sorry.
really, within the video course, I spent a lot of time going through physiology of the big heavy hitters.
Yeah, that's great. That's so helpful for people, especially if that's where they get stuck more often than not. Thank you so much for the Q&A. So, and everybody for giving us your lunch hour and spending time with us on maybe multiple webinars this week. If you've joined more than one to celebrate our MP week, we really appreciate it. And that was such a great presentation. If you're interested in taking a look at the work of Dr. Waters, which includes, I just mentioned, we have a brand new video on demand course that just launched a couple months ago that tackles the C-EFM exam that Dr. Waters is the video host of, so you can get video lessons that go through the exam step by step. We also have textbooks. We have Exam Prep Connect, the digital platform. Any way that you might learn, just like we were just talking about, we have anything that you might be thinking of. Or Springer Pub also has textbooks, pocket references, fast facts, things for your professional practice if you're maybe a little bit further in your career. So if you go to the QR code that's on your screen, that'll take you to our website. Everybody loves a discount for NP week through the 16th. We have 25% off with the coupon NP week spelled out how you're seeing it on the screen. I would encourage anybody who's interested to go take a look and browse and explore the many different titles and ways that we can help nurses who are either students or in their professional practice already. This recorded session, I'll remind everybody, will be available on springerpub.com in about 5 to 7 business days. And for anybody who attended, just for signing up and being here, you'll be getting a free gift from us in your email after the webinar. It will be a featured chapter of a brand new book that just came out. It's called The Guide for the New Nurse Practitioner Transitioning into Practice, which is, we've noticed, a very challenging period for students who want to know, you spend so much time focusing on the exam, passing the exam, and then what's next. So this is something that is intended to kind of help you out with that. And the chapter is entitled The Guide. I'm sorry, that's the name of the book. The chapter is called Finding Your Professional Home. So it really focuses on where does it feel right to be involved and, are you satisfied? And you'll be getting that in your email following the webinar. So thank you everybody for joining. We really appreciate it. And hopefully we'll see you. We have one more webinar for MP Week. That'll be tomorrow at 12 noon. If you would like to sign up for that, go to blog.springerpub.com and find our post about MP Week. It has all of the links to register. That blog is actually by the same author for the book that I just mentioned. So that'll be a really good session if you're available. And thank you everyone. And hopefully we'll see you at another event soon.